We are thrilled to welcome you to our 2020 Connected Health Summit Consumer Engagement and Innovation virtual conference. For decades, we have been looking closely at consumers' use of technology in the home. More recently, connected health and medical devices have enabled new services for consumers to monitor their health care. This has come in all sorts of new form factors and with monitoring services. The global pandemic has also greatly accelerated the use of health services in consumers' homes. We have seen telehealth services skyrocket. 41% of consumers have reported using a telehealth service in the past 12 months, 3 times greater than the year prior. We are excited to bring you 3 days of discussions focused on consumer use of technology in their homes and the impact of the pandemic on new services. With the support of these industry leaders in the health and wellness space, we are able to host this event. Thank you to our sponsors for their involvement in our 7th annual Connected Health Summit. We have presentations from visionary speakers throughout our conversations and networking discussions following our panels moderated by Parks Associates analyst team. We want to thank these industry leaders in advance for their time. Tori Ames, Dr. Donna O'Shea, Mark Dunning, Jean Wang, Richard Culberson, Angie Kolausk-Ebrahimi, Dr. Yuri Quintana. Thank you for joining us for Connected Health Summit 2020. We hope you find value in each session and in connections made with other attendees, sponsors, and speakers.
Hi, I'm Jennifer Kent, Senior Director of Research at Parks Associates, and I'm joined here today by Stephen Bird, who's the Senior Director of Health and Wellness at Nortech, which offers the Numera line of products and services to seniors and their caregivers across a variety of solutions. It has been a challenging year all around, but connected health products and services have really been incredibly important in keeping us connected and providing really critical services to consumers during this time. So as we lead up to the show, Stephen, we wanted to get your thoughts on how this year has really changed things, particularly for the older consumers and their family caregivers that you serve, and the places where technology can really play a valuable role in serving them in new ways. But first, let's hear a little bit more about, can you tell us a little bit more about Nortech and the Numera line of products?
Sure, yeah, thank you, Jennifer, appreciate that. So not many people know the name Nortech as it is, but the sub-brands under Nortech are fairly well known. Nortech itself is a leader in the global security and control market. We make the 2 gig panels for Alarm.com and SecureNet, as well as some high-end control systems with the Elan brand. The linear brand of garage door openers is also ours as well. We have power conditioning devices, Panamax and others. And then we also purchased a analytics company that does voice recognition and facial recognition. In 2015, in July, Nortech purchased a company called Numera that is well known for health and wellness space. They have 3 generations of PERS, the personal emergency system devices, as well as MPERS, the mobile devices. There's 10 patents for the technology, including some fall detection patents as well. The mobile device can go anywhere, so it gets GPS as well, and it integrates easily with existing monitoring centers for 911 type calls around the country. So I'm heading up that specific vertical, the health and wellness vertical.
Well, you know as well as I do that COVID-19 has been particularly impactful on the senior population. We know that older adults are more at risk for poorer outcomes if they're to contract the virus. That's led to a lot of even more strict social distancing than maybe some other age groups might be undergoing. Also a need for caregivers to learn how to care for their loved ones, sometimes virtually or remotely. And this may emphasize some, feelings of social isolation that the elderly population is already, particularly susceptible to. And so can you talk to us a little bit, you're really on the front lines because you are already in the senior market providing them products and services. Can you tell us a little bit about what you're seeing from the people you serve, from seniors and their caregivers? How is this time impacting them right now?
Well, I mean, clearly, like, necessity is the mother of invention. I mean, people are spending a lot more time at home. In the past, we had our professional careers at work, and we did our medicine at doctors' offices. We did our entertainment at the theaters or the theme parks. But that's all different now. They're all converging inside the home because we've all been, forced to be in our home for 6 or 8 months. So in past generations, and our parents' or grandparents' generations, that really would have been impossible. But today's technology, along with the convergence of the technology of broadband and smart home and IoT, we're actually able to realize all that at home, which is pretty exciting. And the telehealth domain and the telehealth world is really no different. Home hubs, remote monitoring devices, patient and physician portals, as well as analytics are converging to create this home ecosystem. Specifically, for our customers, the socially distant world has brought to light the need for caregivers like me, my mom lives in Florida, to be able to remotely manage and monitor, my family and patients. And then for the patients to be able to interact with their physicians and other services remotely if they're stuck at home and can't make it. So COVID has affected the ability really to see doctors. And good healthcare not only relies on the physician, but it also relies on 2 important things: timeliness of care. You have to get care quickly for certain things like heart attacks and falls, and it requires self-management of care also. As we all know, when you go to a doctor, if you are an educated person and what the possible problems could be, or if your mom or dad are with you, if you're older, you're going to get much better care. And so COVID has affected both these paradigms, potentially meaning a reduced level of healthcare. So these independent living technologies that we bring together allow caregivers the tools to access patients' health and wellness status and needs.
Stephen, thank you so much for joining me today. Looking forward to talking to you again during the Connected Health Summit.
Use the question tab to ask your questions or to upvote your favorite questions from other attendees. You can also answer polling questions under polls to give your live vote. Our analysts and panel speakers will be addressing your questions and the polling answers during the live stream. Ask your questions early in the presentation, as our analysts will choose the most upvoted questions to be addressed by the session speakers. If you have any questions during the stream about SwapCard, our team is standing by to help. Just drop a message in the chat or message one of Parks Associates team members via the Parks Associates company page. We want to make sure you're connecting with our industry-leading sponsors in the smart home space. You can visit any sponsor during the session by navigating to the Sponsors tab, browse sponsors, or bookmark the ones that interest you for later. Contact the sponsor via chat, view uploaded documents, watch welcome videos, and more. Have you created your personal event agenda on SwapCard? Go to the Agenda tab, view different sessions under each date, add the sessions that interest you to your personal event agenda. You can access your personal event agenda by clicking the My Event tab. Export your agenda to your calendar to receive reminders and a direct link to your registered sessions.
Good afternoon. I'm Brad Russell, Research Director for Connected Home, and welcome to our last track of the Connected Health Summit, where we're focusing on the future. I think we all realize venture capital investment has long been an indicator of market direction, and in recent years, digital health has enjoyed the highest level of venture funding of any industry. Rock Health recently reported that new deals in the first half of 2020, totaling $5.4 billion, are on track to surpass 2019's total funding of $7.4 billion and even pass the high watermark year of 2018, which closed with $8.2 billion of investment. In the first half of this year alone, 214 deals over $2 million have closed with an average deal size of $25.1 million, the highest average in the past decade. So today we'll be discussing how lessons learned are driving new innovations in tech-enabled care. We'll be thinking about what will the result be from this period of rapid acceleration? How will emerging technologies impact delivery and the care experience? And what new issues might lie on the horizon? Once again, we want to spotlight these great sponsors who've underwritten this experience. Reach out to them in SwapCard and make sure you connect with them. Some of them have been with us many years. We're very grateful, and always have new sponsors coming on board. And so we're grateful for their support. Our agenda follows a familiar path you'll recognize by now. In just a moment, I'll share a couple of very brief insights this time around, a couple of data points to set the stage for two different panels that we'll hold later this afternoon. Following that, our Visionary Insight presentation will be brought by Yuri Quintana of Beth Israel Deaconess Medical Center, where he spent a lifetime studying ways to transform healthcare with new models to connect patients, families, and providers. As always, you can use the questions tab to submit questions for Dr. Quintana. Make sure you get those questions in early so we'll get those queued up in time at the end of his session. Following that, we'll have two panel discussions. The first will be on the future of emergency response. These are 30-minute panel discussions, so we'll be sure to shave about 5 minutes towards the end in order to field some questions from the audience. There's also a couple of polling questions, and so you will find those under the polling tab. You can go ahead and complete those anytime between now and the panel. And then following the panel on emergency response, we'll move more broadly into new innovations and tech impacting consumers' healthcare, where we'll touch on a variety of different kinds of digital therapeutics, maybe a little AR, VR, and some other technologies. Again, submit your questions, participate in the polls. Remember, all attendees that are registered for the event are available for you to connect with in SwapCard. And so we hope that you'll take time to reach out, make a new connection, and see where you have some commonalities. We'll wrap up the afternoon, as we have been doing with all of our tracks, with networking discussions via Zoom. And so at 2:30 p.m., you can click on the links. There'll be two different discussions, one on voice and connected health, and one on consumer devices in healthcare. Now, I want to share a few data points that will help set the stage for our two panel discussions later today. When we think about the future of emergency response, certainly the conversation necessarily begins with personal emergency response or PERS systems. These have been our earliest applications of connected technology for health and safety. PERS devices are well established in the senior care market, and yet even among 75 years of age or over, manufacturers have still struggled to achieve adoption levels higher than 10%. PERS adoption has perennially struggled with the notion that seniors aren't yet ready or don't yet need kinds of technology. And so they've really been relegated to a kind of reactive purchasing process where these systems are subscribed to after some kind of initiating event has happened. I think you'll hear from our manufacturers today that they are increasingly addressing this problem by developing new form factors and by expanding from traditional capabilities to include more capabilities that make these devices more useful on a daily basis and more attractive to even younger seniors. We do know that seniors age 75 and above adopt PERS devices at 3 times the rate of younger seniors. Still, when we expand the definition of what a personal emergency device might look like, we find that there's a growing market for PERS outside of its traditional demographic of seniors at risk of falls. In fact, as more and more wearables have come to market in the form of smartwatches and fitness trackers and GPS sports watches, we find that a growing percentage of younger consumers are purchasing these devices or systems with some kind of PERS functionality. And so that when we ask consumers more specifically about just do you have some kind of panic button on a connected device that you own, we find that self-reported panic button ownership is highest among heads of household age 18 to 24, with the next highest rate of adoption among those 24 to 44. Furthermore, about a quarter of Apple Watch users report owning a panic button, with many considering their watch to serve that function. Of course, all Apple Watches actually have the feature, so this is more indicative of those who are aware of the feature and think of it as a kind of personal safety device. In light of all of these smartwatches and other kinds of wearables, we find that there's a growing market for PERS outside of its traditional demographic of seniors. You can think of city dwellers or urban people, fitness enthusiasts, outdoor adventurers, consumers with security and health concerns. All of these represent a ripe market for device makers and service providers. Now, when we think of PERS device capabilities, we find currently that over a third of users of PERS devices subscribe to some kind of professional monitoring. Another roughly 25% have 24/7 access to registered nurses and doctors. We see the addition of features like GPS and location tracking, so mPERS for use outside of home, and then an increasingly number of capabilities around fitness and wellness, so fitness tracking, step counting, medication reminders, and features of that nature. Now, moving beyond PERS more broadly to the range of connected devices that we have been talking about throughout this conference, we find that approximately 20% of adults under the age of 65 show high purchase intentions for a range of connected health devices. Now, when we say high intentions, we mean on a scale of 1 to 7, consumers who rate the likelihood of their purchasing a device in the next 12 months to be rated a 6 or a 7. So these purchase intentions rates actually are approaching those of some of the most popular smart home devices, roughly 20%, across these device categories, from smart thermometers to Wi-Fi weight scales, connected blood pressure cuffs, etc. Given the very critical role these devices will play in the future, not only of health and wellness, but in chronic care management and remote patient monitoring, these purchase intentions are very strong indicators of a positive direction for the market. Finally, we know that there have been a variety of digital therapeutics that have come to market in recent years: health websites, telehealth, virtual visit services, as well as self-diagnosis apps and symptom checkers. Again, we find that 1/3 of those under the age of 65 rate the familiarity with these kinds of digital health tools as very high, with health websites accounting for roughly over 30% of those under the age of 65 being familiar with them, and about equal number familiar with telehealth services, and about almost 30% of under 65s rating themselves as highly familiar with self-diagnosis apps. We know that those who've used self-diagnosis apps are confident in the results and express high intentions to use them again. Now, with those comments, it's my pleasure to introduce our Visionary Insight speaker this afternoon. Yuri Quintana will speak on transforming healthcare, as I said, with new models to connect patients, families, and providers. He is the Chief and Division of Clinical Informatics at Beth Israel Deaconess Medical Center, as well as an Assistant Professor of Medicine. He spent a great deal of time working on a project called InfoSage, which is a platform for home-based elder care coordination. So give us a couple of minutes to pull in our video feed, and then we'll welcome Dr. Quintana.
The COVID-19 pandemic has thrust virtual solutions to the forefront of healthcare. Sweeping regulatory changes, combined with changing consumer preferences regarding in-person versus remote care, have created an enormous shift in the market, and very quickly. In the past 12 months, 41% of U.S. broadband households used a telehealth service, nearly tripling year over year. Further, 83% of consumers who use telehealth services had their most recent telehealth visit paid either completely or partially by insurance. Consumers consistently report preferences for local providers for virtual consultations, and the market is now meeting that demand. In Q2 2020, 46% of recent telehealth users report using a service offered by a local physician's office versus only 13% in 2019. The industry now needs to expand providers' ability to collect and integrate data from a wide variety of connected health devices, to deepen the provider's understanding of patient needs, and expand the issues that may be addressed via virtual care. Thank you for joining us to learn more.
Good afternoon, Dr. Quintana. Welcome. Thanks for joining us today.
And I appreciate the opportunity to share with you the work that we're doing here at Beth Israel with colleagues around the world.
Wonderful.
So today I'm going to be talking to you about new models that we've been thinking about how to deliver care, and in particular and how to sort of share information, not just with patients, but also families. And so this work has been done here at the Division of Clinical Informatics, which has been around for 50 years. It was one of the first divisions in the world that was created to study the use of technology and informatics to improve the care of patients. It was founded by Warner Slack and Howard Bleich, who, as in the late 1960s, were already building patient-centric systems. And so it's my honor to have joined this division, and I've been inspired throughout my life, professional life, by their work. And they have always sort of championed the need to put the patient first. So today I'm going to be talking to you about various technologies and products, some disclosures. We do have funding from Pfizer for educational programs that we run for informatics fellows, unrelated to this particular presentation. InfoSage, which I will talk about, a system we developed, has been developed with funding from a federal research agency, AHRQ. And I will be mentioning various products, and they're mainly for illustrative purposes, so we're not providing any particular endorsements, and there's no commercial relationship with the products that I will mention. So I think everyone here is fairly in depth in the healthcare. I just want to summarize some of the challenges that I think are among us in the next decade or so, and how we should maybe use those types of trends and indicators to sort of think about where we should strategically put our energies. And so it's clear to all of us that, you know, aging is a growing challenge. It's not only true here in the US, but it's worldwide. And we have a need to be able to manage more people and to help manage them in a place that they're comfortable. And most people would rather be in their home rather than in a hospital or in a high nursing home. So how do we do this? And one of the challenges is that not only have a growing aging population, but we also have a population that has multiple chronic diseases. And most of the costs associated with healthcare are related to chronic diseases, which now stretch across the entire world, and it's impacting other areas. And this can have actually a crippling effect on the economy and the way in which we run our companies and organizations. Healthcare is one of the major costs. And so here you see that in the United States, 31% of people have multiple chronic conditions. And the studies show that of people who have multiple chronic conditions, the vast majority are people over the age of 65. We also see that the cost of where you care for people varies greatly. And while there are some high-end nursing homes and assisted living, you see that the costs are generally much higher. And so the more you can have people live at home independently or with periodic visits, the lower the cost will be, and people tend to prefer to be more at home. If we start digging in deeper into the actual costs, the costs are really in the hundreds of millions, if not billions of dollars. And with older adults, dementia-related diseases are a growing problem. And this poses a particular challenge in how you do home monitoring and support. So as people have multiple conditions and also challenges with their mental capacity, we're going to have to find ways to not only use technology, but inevitably families get involved to support those families. And how do we support those families with home-based care? It's also clear that we have a shortage of health professionals, and geriatricians in particular are in very short supply, and the number of geriatricians that are graduating are not graduating at a rate fast enough to keep up with demand. So clearly, the hospital-based system will not have the capacity to treat all the people that need help. And so we're going to have to find how to bring care into the community and into the home. And the question is, how can technology help in that? Among the many challenges that there are with care at home is the problem of medication adherence. And as you can see, we know that across all age groups, medication adherence is a problem, but it's particularly a problem when you're older and you have multiple medications. It can be confusing which ones you take. And it also takes a lot of effort to sort of be able to understand when to take those medications. So we were particularly interested in figuring out how to help patients with all of these challenges. We also know that there's poor care coordination, and this is a problem globally, not just in the United States. And poor care coordination among clinical teams, the communication between hospitals and the family care provider is a particular problem. So those communication problems, if they're not resolved, are going to result in poor healthcare delivery. And as families become more involved in the care of older adults, this becomes a greater financial and physical burden as well. So financially, most Americans do not have the financial ability to send people to high-end 24-hour care facilities. The public ones have a wait list. So increasingly, by necessity, either because you don't have the financial means, or there's a wait list, or it's just not available in your region, more and more care is going to be done at home. And as people care for people more at home, a lot of the times it usually falls on one particular person. Unfortunately, a lot of the times, by statistics, it seems that it's a woman in that family in 2/3 of the cases. And whoever is the care provider, it becomes sort of a burden that can actually affect the health of that care provider. So they start to suffer burnout, both physically and mentally. And so one of the challenges is, how do we get more families involved to coordinate their care of their family, older adult, to be able to do that? So Leading Age, which many of you are probably familiar, a nonprofit group, advocated in 2017, as is many other groups, for integrated service delivery, a way in which we coordinate our communication, our technology, have a single care manager that serves as a facilitator to share information and support the care. And unfortunately, this is actually incredibly difficult to do because, as you know, our healthcare system is already fragmented. And then there are, even though there are many different technologies showing up on the marketplace, and also academics are building systems, those systems sometimes don't easily connect with each other. So we have a plethora of technologies and systems, and it's still very much a work in progress. And so one of the challenges is, how do we take a systems-based approach to solving these problems, and how do we try to make these systems more interoperable and have the workflow and communication more seamless so we can have better care coordination. So as you know, the internet continues to be adopted worldwide, and more people over the age of 65 are using it. So that's a positive. However, it does tend to start plateauing beyond 65. And then because of all kinds of reasons, including challenges of mental sharpness and your physical dexterity of your fingers, it becomes more difficult to actually use technology when you get to 75, 80, and beyond. And if we look more deeply into the actual stats, we'll see that definitely by the time you're 80 years old, very few people are actually effectively using a smartphone, and internet usage also drops. So as we have all of these technologies for wearable devices and Internet of Things type devices, the challenge will be for those people that have lots of chronic conditions and are over the age of 75, how do we make these things actually work? How do we get people to actually accept them and be able to use them? So it's not a given that even though we have lots of technology, that those people over 75 are actually going to use them. And so our founder, Warner Slack, here you see a picture of him in 1967, built one of the first systems to collect information from patients so that when you actually went to visit your doctor, they could use that information to better contextualize your care and understand your preferences. And so he very much believed in patient empowerment, getting information from patients, giving them choices. And he said in a very forward-looking statement in 1970 that the most underutilized resource in healthcare is the patient. And to this date, that still remains true. And so our challenge, I think, as we try to build these systems, if you truly want to make them patient-centric and family-centric, is how do we understand their preferences, needs, and try to create solutions that, from their point of view, that work for them, not just for the providers or other people who have financial stake in the game. And so we started 8 years ago developing a research program to understand how to use technologies to support older adults and their families and help create an environment where they can do more care coordination at home. And so we got funded by AHRQ through a series of grants to begin building a system. And we began with lots of focus groups with families and patients to understand what were their challenges and what do they need. And so the problem is that as we become older, we increasingly depend more on our family members, and we need to find ways to provide support for them, but in a way that's respectful of how they would like to be cared for. And so we have developed through that a recognition that there's all kinds of places where a patient can get care. So it's not only at one particular healthcare provider. You may have multiple specialists that you see. You may be getting your medications from more than one place. And family members are trying to help you manage all of this. And so building a solution that's tied to a single hospital, I think, won't solve the problem, because most people who are over 65 and have multiple chronic conditions will have multiple providers and multiple services. And so the question is, how do we build an ecosystem of technologies that is more easily can more easily be integrated and has high usability and high value both for the patients and the people who want to connect. So I know that's sort of the challenge of this conference, but I think we need to recognize that as we build these systems, it can't be just tied to one hospital or one provider, one technology provider. And so the question is, how do we collaborate and make these connections and create scalable solutions? And so what became apparent through these focus groups was that one of the things that people found particularly challenging is care coordination, how to communicate information among family members, who is going to be doing what, and how to respect elders' preferences as to who they want to be in their care group and who has access to things. And so some elders would say that they were perfectly happy with sharing most of the information with their immediate kids that were involved in their care. But maybe, for example, for certain medications, they didn't want to share that information. So they wanted control at somewhat granular level for certain things. And one of the things that came up is, for example, some of them said, well, I don't want them to know I'm taking Viagra or I'm taking this particular medication for an infection. And so what we have developed is a private social network that's centered on the patient. We call that person the keystone, the older adult. And while we develop this for an older adult, it doesn't necessarily have to be an older adult. It could be any kind of patient. And that person gets to decide who is in their care network. It can include family members. It can include healthcare providers. And those people who are in that network can have different levels of permission. And within there, you can have a shared list of tasks. And these could be things that different family members are doing for the care of that patient, such as taking them to a medical appointment. It also includes medication management. It sends reminders for medications. You can define certain people to be part of your caregiver team, and so they can also get those reminders as well to be able to help you help the elder remember to take those medications. And then it also has a private communication network for that people involved in that care network. And so here you see some of the different layers of controls in terms of permissions and access. The keystone being the elder or the patient at the center of the network. They can designate someone who is a proxy who can help them edit, manage, and add people to their network and has full access to that. A trusted proxy. They don't have to, but they can. Caregivers are people who are involved in managing, helping to manage medications and tasks. And then you have another group of people who are participants, maybe who are communicating with them and sharing information and sending messages of support, but aren't actually involved in the care of that elder. And so this allows you to create a flexible architecture, a flexible network, defining people's roles within that private network. Here you see some of the different tasks that you can do. You can add things that people can do. People within the network can volunteer to do certain tasks, and you can check them off. You have a list of medications as well that you can add. And there's an Android and iOS app as well. And it connects to RxNorm, which is a database from the US government that gives information about drugs, but it also, interestingly enough, gives you drug-drug interactions. And so we give alerts when there are two drugs that may have a potential adverse effect, so people can understand those potential consequences of those interactions. And over the last couple of years, we've been developing usability studies and adoption engagement studies. We've iterated on the design of the web page and also the mobile app. And we're at a point where it's, because medications are actually not a super easy thing to add, because there's lots of different ways to add it. We've started on voice interfaces to be able to add medications by voice and get reminders by voice. And we're also developing this in different languages. And we have a version in Chinese, and we're about to launch with a few other languages as well. And so we've piloted this here with our patients here at Beth Israel. We also have partners at senior living facilities here in town, Hebrew Senior Life and LaSalle Village, who have different levels of care. And LaSalle Village is more an independent living facility. As I mentioned, we've translated this to Chinese, and we have a version in Spanish. And we're working with different other groups to see how we can connect different devices to this platform for better symptom management. And what we've discovered is that there are all kinds of families. There's no one particular structure. And each family decides what the network is going to look like and what roles and permissions. And so here you see two different types of families, and you see some of the network activity over time. And so while there is regular activity in terms of just general communication, there are definitely spikes of events, which are usually triggered by significant changes in medication or health status. And so one of the challenges of bringing this technology is that once people have it and are using it, they value it. But a lot of times people don't feel they need to sign up for the system. And then when they do want to sign up for the system, they find that they're just very stressed with many different, many challenges with the care of that elder. And so a key open research question is, how do you get people connected to the system, engaged, using it such that they are functionally, can function and operate in that environment, so that when there are more serious conditions, they're already set up to be able to connect. And so we're trying to see how we can introduce it at earlier ages and what is the model for that. What we've discovered from this work is that you can create family-centric networks. InfoStage is not directly tied to a particular healthcare system. We're building FHIR interfaces now to our medical record. Beth Israel merged with Lahey, so we're now Beth Israel Lahey. And so we actually have two major medical centers. One has our homegrown system and another one has Epic. And we have a whole pile of other smaller community hospitals. So all told, we have 30 different clinical systems in our network. And so certainly a patient portal stuck to one hospital wouldn't have been giving you the breadth of knowledge and so of that care continuum and health information. So by connecting with FHIR interfaces to different healthcare providers, people will be able to import their medications and to be able to manage them, and then add additional medications such as over-the-counter medications. We've done several usability studies as well, and have found that Elders do use the site at a surprising level. So well over 50% of the elders who have signed up have directly used the system. We do see a significant drop off beyond 75, and certainly over 80, it drops off considerably, which is why we think we need voice-based interfaces and different form factors. Families are spread out throughout the city, and today with the issue of COVID, it becomes even more necessary to create these types of virtual networks, because families actually shouldn't be seeing an elder if they are, for example, in frontline jobs as well. So more important than ever is to be able to create these sort of environments that allow families to coordinate care and minimize their physical contact. So there's a huge team that has worked on this over the last 8 years, and these are some of the different people that have worked over this product. So I want to finish up by talking about, so what's the future? How do we evolve this this model and make it even more scalable? So one of the things that we're working on now is better symptom management at home, and how to build this technology to track more reliably the symptoms, finding different biometric devices and voice-based interfaces that can collect symptoms of the patient and collect that data, but also aggregate it and analyze it in a way that we can then communicate it back to the providers in a way that's useful to them. And so one of the things that most doctors will tell you is that they're inundated with information. So getting 50,000 more data points on one particular patient is not really what they need. What they need is sort of better summaries of how has the symptoms changed, and then those, what are the rules which trigger alerts? And those are very dependent both on the patient's previous medical history and what their baselines. And so people do want to have an ability to customize those alerts. And so there's a lot of workflow integration that needs to be done to make these fully functional. I know that many of you are working in that area, but I think it's still a work in progress to be able to create the reliability of these alerts and the acceptance by the healthcare providers. And at the home end, we need to find better acceptability of some of the hardware devices to be able to deploy them, particularly with people over the age of 75. We're working also in extending this platform across multiple diseases. So we're working both on cancer care, diabetes, and mental health. And as I mentioned, chronic diseases are major problems. So I don't think people want to have 3 or 4 different systems in the home. So we need to develop systems that can scale across different diseases. As people have additional conditions, they can have that module added to their InfoSage. And so I think the architecture of these systems will be things that are going to be more plug and play. And there's probably not room for 20,000 different platforms. I think there are going to be a few really well-designed home monitoring platforms that are going to be very easy to integrate with external groups who develop smart analytics and sensors and can plug and play and be able to do those home monitoring devices. And finally, there's an opportunity for big data collection to be able to collect data from very large numbers of people to do home monitoring. We're doing we have some grants out in place to do large-scale monitoring of COVID survivors to be able to better understand how to help them manage their symptoms beyond after they survive COVID. So what are these models going to look like? I think they need to be designed very much patient-centric, and we need to spend even more time understanding how do patients want to interact, what are the barriers to using that. Certainly, they don't want to connect to 10 different networks, and so they want to have simplicity and flexibility, and so we need to do more work on co-designing with patients. We need to understand the communication workflow between families as well as the multiple providers that are involved in their life, and not just work with one healthcare system. We need to be able to personalize content that can help people manage those symptoms, and we're working in that area in dementia and cancer care to be able to help create tailored education depending on how their symptoms have changed, and to measure how those symptoms have improved to reduce the number of readmissions at hospitals. So we have some studies in that area. Finally, I think it's super important to understand at the home end the accessibility and usability of these systems and how these systems connect to the healthcare system through interoperability. And finally, and probably most importantly, we need to measure the impact of this, because at the end of the day, we need to be able to show that we have better outcomes from the part of clinical outcomes. We need to make sure that patients feel empowered and have better quality of life, and that will reduce costs. And so if you have an evaluation that's too focused on one area, say cost, and not the others, you won't have a balanced, sustainable solution. So these evaluation studies are super important to understand how can we make these achieve high enough value for the stakeholders such that they're willing to invest further money to sustain that. So these are some of the publications that we've done, and I'm thrilled to have had the opportunity to be able to share some of the work that we're doing. And I'd welcome any questions and comments either now, and there you see my email, and happy to follow up afterwards if we don't have time to answer your questions. So thank you.
Yuri, thank you very much. I think a lot of people on our call today can certainly appreciate what a heavy lift all of this has been for you and your partners over the last 8 years or so. We invite our audience to submit questions. We have about 5 more minutes. And so while we're waiting for some of those, let me ask you a couple of thoughts that come to mind for me. What's the long-term vision of InfoSage? In other words, is it, do you envision to be an open platform, kind of nonprofit backed, freely available? Do you see it commercialized as a proprietary platform? Kind of what are your thoughts long-term about its commercialization?
So both are possible. I think I have, having been on panels to review startup companies, I see what a heavy lift it is to sort of get a company not only launched and sustained. And we've had some spin-off companies from our division who have sort of done well up until sort of recession hits and peak budgets get tight. And of course, we're probably going into one of those sessions. So, I think probably we will either make it open source or license to someone who can run with it. As an academic unit, our long-term vision is to build technologies for those smart alerting systems for symptom management that could be plug and play across an architecture. And so even if our platform isn't sort of goes open source, I think there's another part of a valuable contribution that we can make is what are those sort of smart alerting systems and how they're designed to be able to provide appropriate alerts. I know that the doctors that I work with are excited to see this technology, but also realistically say, I have so much, I'm inundated by information. And so I'd have to really have a high degree of confidence that the recommendations and summaries and analytics are reliable enough or actually going to save me time than doing this. So I think we still need a lot of validation work to make those modules that do alerting for healthcare providers to be useful for them.
Sure. It's that classic question of actionable insight, right? What is the next step in the workflow that actually could be optimized because of the information? So this could be a reference design. You mentioned kind of an architecture for someone else to pick up on. It sounds like it's kind of an open future.
Yeah.
Obviously, this is enormously expensive and the scope is very vast. All of the ways you're thinking about integrating with other databases and content sources, I think is it's very wide in scope. We did have one question come in from our audience, and they're curious, in your testing and user experience testing so far, with which features in the app do your Keystone or family use most often? What are you finding is kind of the low-hanging fruit as far as?
So for now, medication management has been sort of the growing need, the growing portion that people have started to use. And because I think one of the problems that so we have a private discussion group area, which that sort of competes with other discussion things that you can easily set up through, a text messenger sort of chat area. And so I think the value proposition for us is to sort of build tools that people can manage their medications and their symptoms. So our next evolution of this is sort of tracking symptoms and being able to relate them to the medications and giving people advice to help them manage. So we're developing some work on cancer patients to be able to manage their adverse symptoms as they're getting chemotherapy and other conditions. And particularly, we're interested in the drug-drug interactions and seeing whether how to manage reduce nausea and things like that. So I think that'll be a growing area. And I think as those features become more valuable to them, I think people will feel more comfortable using the chat area in that space. But the chat area has not been that useful as used as much. We started adding resources to people, and that sort of is an ongoing effort to sort of maintain educational resources. So we're looking for partnerships. Part of the reason I was interested in here is this, we're not trying to reinvent the wheel. We're trying to invent what's doesn't exist right now, and connect to other devices, people who are producing educational content, and then have this sort of as a reference platform for how we could do wider scale integration.
Sure. Well, I certainly can imagine how some of our listeners who are deeply involved in smart home automation, and interoperability, would make great partners for solving that interoperability piece, which many of them have been working on, for a decade, and have interoperability with, hundreds, if not thousands of devices. So, I think that'd be an enormous opportunity. Well, listen, thank you so much for sharing your thoughts and your very important work with us. If we get more questions, we'll pass them along to you.
Okay,
But thank you. We really appreciate you being with us today.
Thank you.
All right, next up, we will have our panel on the future of emergency response. Certainly those of us who've been watching the PERS market and have seen some rapid pace of evolution in recent years. We're seeing some innovative product designs, much more simplified user experiences, app integrations with other wearables and connected health devices. All of these developments have characterized the evolution. And beyond serving traditional elder users and their caregivers, as I mentioned earlier, we do see this growing percentage of younger consumers that are purchasing devices and systems with PERS functionality. So it's my pleasure to introduce our panel this afternoon. We're pleased to have Josh Garner with Beckler, and Shay Gregg with FallCall, and Jeff Gross with Medical Guardian, and Tad Reynes with AT&T. I'm going to let each of them introduce themselves this afternoon and share a little bit about themselves, their company, and their perspective on the industry. First up, welcome Josh Garner.
Hello. Hi, everyone. It's good to be with you today. I'm happy to be on the panel. Thank you, Brad, for moderating us here. Just to give you a little bit of background on myself and Beckler. I'm the CEO at Beckler, and Beckler is the parent company of two operating businesses, AvantGuard and Frius. And AvantGuard is a 24/7 wholesale monitoring company. We monitor all kinds of devices, anything that needs an event response, from security systems, medical alarms, fire alarms, IoT sensors, crash detection, you name it. Those are the kinds of things that AvantGuard monitors. Frius is a mobile PERS manufacturing company. We manufacture a device as well as design and build the platform that supports that. And you can imagine where all of those devices are monitored at the first company I mentioned, AvantGuard. And so both companies are in the B2B space. We don't sell either services or products directly to the public. Our customers are our companies like Medical Guardian, whom you'll meet here in a few minutes with Jeff Gross as the CEO. And that's who we are. We're headquartered in Ogden, Utah, and we are servicing over 500,000 mobile PERS users with both of our platforms. So, thank you.
Great, Josh. Thanks for that introduction. Next up, we have Shay Gregg, Dr. Shay Gregg, the founder and president of Fall Call. Welcome, Shay.
Good afternoon. Hello, everyone. It's honestly, I'm humbled to be on a panel with my co-speakers today. So I thank Parks Associates for that opportunity. And Brad, thank you for obviously overseeing this session. Again, my name is Shay Gregg, Dr. Shay Gregg. I am a founder and president of Fall Call Solutions. And what we do is we create wearable and mobile apps for the popular technologies that are all over the market at this time, including Apple Watch, iPhone, and all the Android devices. And the areas that we really focus in on are medical alert, simplification and access, as well as addressing and combating social isolation. Where this sort of passion came out of 5 years ago to start the company, it came out of the trauma bay. I'm a practicing trauma surgeon and as well as burn surgeon, acute general surgeon as well for emergencies. And the greatest growth in volume that we've seen are people over the age of 65 who fall on anticoagulation. And, you see enough of those patients who are either not using their devices or don't have access to personal emergency response devices. They come in on the floor in renal failure with a variety of other medical issues. And you see enough of those, and it gets to you, and you want to do something more. And that's where Fall Call came out of that observation. And currently, we've been on the market with our two apps, Elder Check Now and Fall Call, for several years now. And, where we have a growing user base, thousands of downloads, and we offer something sort of new in terms of integration points and personal emergency response into third-party central monitoring systems. So I'm eager to hear what my colleagues have to say and offer some insights on where this world is going from my standpoint. Thank you.
Great. Thanks, Shay. All right. Next up, I should say welcome back to Jeff Gross. You've been with us a number of times, CEO and founder of Medical Guardian. Welcome, Jeff.
Thanks, Brad. Great to be here, and always disappointing when I can't make a trip to somewhere nice like San Diego. But it's great to be able to do this with people I know like Shay and Josh. And a little bit about our company: we've been in the emergency response business for 15 years now. We have a business that spans different channel segments, from D2C to retail to healthcare. We offer an array of products ranging from home to mobile to wearables, including our most recent product, which you see in the picture there, the Mini. Currently have about 150,000 active subscribers, about 230 employees, centralized in Philadelphia. And if you see anything around our brand, you will see that we pay special attention to empowering our customers, and an entire messaging campaign and product service assortment based around that. We promote an independent, active lifestyle. Our goal is to empower customers to live a life without limits, any type of life that they choose. And it's been particularly important these last 5.5 months as the awareness of this category has been elevated. And, we're pretty excited about some of the opportunities that are coming out of that to be able to protect people and allow them to keep living safe and protected at home.
Great. Thanks for that introduction, Jeff. And then rounding out our panel this afternoon, we have Tad Rainans, Regional VP and Healthcare Solutions at AT&T. Welcome, Tad.
Hey, Brad. Thank you. I appreciate it. Great to be here today. Thank you for the invitation. Tad Rainez. I head up the healthcare practice within our Internet of Things organization. And the connectivity of many of the devices that have been discussed before my part of the presentation run on AT&T.
So my folks know, how to support devices that have become increasingly popular and important during the COVID crisis that we live in today. The slide that you see now is a network that we rolled out a couple of years ago called FirstNet. It's especially poignant given today's conversation because it is dedicated to first responders. It was born out of 9/11 and the lack of coordination that came with the multitude of first responders that came to the crash site to assist, and the inability to discuss plans and needs over different radio bands. FirstNet was put out to bid years after the crisis. AT&T won that bid, and a couple of years ago started rolling out the network. So it's been very popular with first responders, and has taken on added importance with the emergence of COVID. So I look forward to touching on that today and speaking with you, Brad, as the afternoon goes on.
Great, Tad. Glad you're joining us today. Well, I want to remind our audience that we have a couple of polling questions. You can access those on the polling tab. We'll look to those in just a moment. We've been starting almost all of our panels with kind of some context setting with COVID-19, and certainly this topic of emergency response is so relevant. And I'm wondering to hear from each of you, how has the COVID experience in both elder care facilities and among those living alone impacted interest, demand, and outlook for the PERS industry? And Josh, I'm going to start with you. How are you seeing the impact of COVID?
Well, that's great. Thank you, Brad. As I mentioned in my intro, my customer is the dealer, so I'm one step removed from the customer interaction. But what I see from our dealers is business is up. Things like fear and social isolation are tailwinds for the PERS industry. If there's been any challenge to my customers, it's been around their own internal staffing. It's people, we can't get enough people in the office to make the sales, but the phones are ringing off the hook, and people are very in need of these services and wanting these services more than ever. So we've seen it as very good for business.
Great. Thanks, Josh. Now, Shay, I want to turn to you. I know you've been kind of on the front lines of caring for people in the midst of COVID. What's been your experience as you think about the emergency response industry as a whole?
Sure. Just a note about COVID. I'm an ICU trained doc as well, and it is when you get it and you end up in the ICU, it was a horrible experience for those who were afflicted with it. So honestly, my heart goes out to the families, et cetera, who have had to deal with this disease in the worst, in the worst setting possible in the ICU. It's can be fulminant when you get it. Yes, there's a whole spectrum, but if you wind up in the ICU, we provide the best care, but it's been a real challenge. Regarding emergency response and in the fall call world, what we did see is tremendous growth. I agree with what was just said. We've seen during the surge, especially the early surge in April and May and June, we saw 50% growth in our downloads. We saw 30% the next month. And I think it is a tailwind. And I think all of us on this panel want to share the idea that we want to be there for you when should there be an emergency, should there be a need, and we want to be there quickly. So it is a horrible disease when you do get it severely, and it has actually boosted, I think, downloads and growth in the industry.
Sure. Appreciate that personal experience. Jeff, I want to turn to you. Certainly, traditional concern for fall risk, emergency response is the core value proposition of PERS. But I wonder how you're thinking about extending capabilities, maybe to address other senior pain points like social isolation or, interoperability with other kinds of remote patient monitoring. What are your thoughts on that direction?
Yeah, it's been enlightening in so many ways, and it doesn't stop. When you talk about acceleration of different services that have been spoke about over the years, from telehealth to video to even passive monitoring, we're looking at everything. Telehealth is probably at the top of the list of any PERS provider right now. But when you really look at the type of reactive solutions that we've always provided, where people wait till a fall or a medical emergency has happened, the general model of PERS with drop ship, phone support, you take away that element of human to human care that you see in other senior services such as home care or any type of facility. It really lends itself well to exponential growth in this category and all sort of related services. But we're very interested in aside the obvious telehealth, passive monitoring with sensors, cameras, and everything in between, but also video. I mean, this has connected a group and demographic that was very phone heavy and is now phased to be on Zooms and FaceTimes and all other types of video connections with their loved ones and also professional caregiving, doctors, nurses. And so we think this is going to be a big part of the future, not only on the servicing side, potentially the acquisition side and other solution side. So it's pretty exciting to think about and probably something the category really needed, although it's been obviously a tough situation that nobody's gone unscathed from. We'll be able to protect a lot of people from it.
Let me follow up with you on that. I implied in my opening comments that these expanded capabilities are what's going to be necessary to attract a younger user and a different type of user.
Yeah.
Is that on point? Is that the way you're thinking about it, or are you thinking about just more holistically serving caregivers and the elder community?
Well, when you say younger, a lot of people have different variations of that. Our idea of younger is to get someone to come on board on an average age of their mid-70s. So when I started this business 15 years ago, we onboarded customers at about 80 years old. That's now the current age of an active customer. They come on board a couple of years younger than that, 77, 78. And our goal is to drag that down to 74, 75. We do that by having, like I said in my intro, a messaging campaign that resonates on a deeper level, that's respectful and has a deeper emotional connection with people, but also, more importantly, offer them product and services that add additional value, that are smaller, that are lighter, that have better aesthetics, that have additional feature sets that make sense, that aren't complicated. So simplicity is important, but it's really the convergence of all those things that's going to allow us to attract a younger, more inspired audience and be able to keep them longer by giving them additional value on a daily, weekly, and monthly basis, rather than insurance that you wear in person that you're waiting 99% of the time to use and you never use. And that's a good thing, but it doesn't exactly sort of build that engagement and value in your service. So there's just a tremendous opportunity to do that.
I think that's one of the things we've seen across different kinds of smart home use cases is that outlier events are a great urgent driver, like the home security business.
Yeah.
But if you can couple that with things that people will engage with on a daily basis, suddenly the value prop goes up. So I think that's interesting. I want to turn to our first poll question with our audience today. We ask a use case question: what use cases for PERS solutions will likely be the next thing? And we gave you a bunch of options there. Certainly, by far, people think adults, children at risk with health concerns. So maybe thinking more broadly beyond elder care, but certainly health being the fundamental use case for an emergency response. Secondarily, remote or hazardous job workers. So this, in fact, is something that we've seen on the B2B side of the business. People that are working in remote locations or they're working in dangerous jobs. And so almost a third of you think that could be one of the next big areas for PERS. Lesser so for urban dwellers or some of the other needs. It is interesting, ADT this last year, it's not exactly a PERS system, but they rolled out what they call mobile personal security, where someone can have access to 24/7 monitoring, kind of like OnStar, wherever you are on the planet. And so that's kind of a more broader way to think about personal safety anytime you're in a context where it may not be familiar or whatever. Tad, I know use cases aren't necessarily kind of where you live every day, but do you have any observations from maybe thinking from a first responder perspective about some of these other segments of PERS users or what first responders might need in the form of data in order to kind of respond to these other kinds of situations or to vet them? Any thoughts about that?
Yeah, absolutely, Brian. I mean, I think the thing that's so great about a lot of the PERS devices is just, how smart they've become. It wasn't that long ago that, the PERS device didn't even know when an individual had fallen. The commercials we all grew up with, showed the senior, touching the button and then calling out for help. The devices now are able to detect that on their own, and they oftentimes carry a number of, vital signs within them, so that first responders can get to a site to provide assistance and actually already know a lot about the individual that they're coming towards before they actually have to diagnose them. So to be able to get that kind of information ahead of time, I think the first responders feel better prepared for the situation they're walking into. They have an idea of what they need to do the minute that they get there. In some cases, they actually can even have conversations with that individual before they're on site. So I think for any first responder to be able to gain that information before walking in ill-informed is a godsend for them.
I think we're losing your audio just a little bit there at the end, but yeah, I like what you said. One of the things you sparked in me is when we think about the use of video and audio analytics in the home for home security, the passing of other metadata along with the video feed itself has become really critical as far as video verification and validating the event, and then passing this kind of other contextual data to first responders so they could know, are there other people in the home? How long has has the home been occupied, or other things, the presence of other dangerous threats maybe. So yeah, I think that's really, really interesting. Thanks for that. Shay, I want to turn to you. I know your approach with Fall Call has been kind of a BYOD approach, right? Where you're developing apps for well-adopted consumer wearables such as the Apple Watch and Android devices. Obviously, you're bullish on that strategy, but I wonder if you could just talk a little bit about maybe the pros, and are there any cons with that strategy? And do you see this approach extending to a wider array of devices? I'll ask others to chime in after you, but I want to let you go first.
Sure.
So what do you think about that?
Sure. So the pros are, you have got some of the best hardware that's been developed, most innovative hardware that could possibly be on the market today in terms of the maturity, the strength of antennas, the processing power of computing systems. I mean, this device that you can wear on your wrist has incredible computing power if you were to hook it up and watch the processes that could be run at any given second. You combine that with the cellular connectivity. We've done reliability tests on our devices where we ask the question, how frequently will you be able to reach the central monitoring center on the 4 major networks from your cellular connection on your watch. So using the 4 major networks that people connect to, and we were finding reliabilities of just about 100%. We saw 98.8 or 98.12% of those reaching that central monitor. I'm proud of that data, and actually it's even higher nowadays with the newer series watches. So again, you have distribution. It's been estimated both by Parks Associates or by your work and by validated by other sources that approximately 2 to 2.5 or more percentage of elders over the age of 65 own Apple Watch in particular. So that distribution equals about 600,000 people at least, and I'm sure it's gone up with estimates of 15% growth year over year in that segment. So by always sort of innovating ahead, differentiating yourself from the base software, namely we hook up to central monitoring. We just entered into a partnership where we have a Bluetooth purse device made by TrelloWare, a stylish accessory hooking into our system that can contact the central monitor system. That's, I'm imagining, is outside the Apple interest. We're going to go into our beta test for fall detection. We have the ability to actually use AI in our cloud to study accelerometer data constantly and actually evaluate if people are getting up in the middle of the night, et cetera. We have all those capabilities on these amazing devices. Now, the cons are that you're limited by frameworks and you're limited by battery life, et cetera. But obviously, those frameworks change. So when you get your new operating system, you're going to be stuck possibly paying catch up, et cetera, with screen changes, movements, et cetera. Obviously, with any sort of worldwide platform, you're going to be struggling with that. But so long as you can innovate, differentiate, and really go sort of in a forward-thinking manner and design specifically for the population in terms of human engineering, I think that you can do quite well, as you seem to be doing on these platforms.
Great, thanks. Jeff, I want to turn to you. What's your take on kind of BYD approaches and how this technology might be extended to other devices?
Yeah, we think there's a nice market for it. I mean, we're very focused on dedicated devices at the moment. As you may know, we created a smartwatch made for an 80-year-old, as I like to say, called the Freedom. So when you look at that versus the Apple Watch, there's a couple of obvious feature differentiators. They look similar. Ours is a little larger and thicker, but still quite slim, relatively speaking, has a digital face, offers messaging, offers reminders, and of course, emergency response at its core, has a longer battery life and less features. So we think there's a particular simplicity and feature set that's needed in the marketplace for devices like that. But there's also a lot of opportunity when you talk about, you mentioned social isolation, depression, loneliness. We think there's a lot of opportunity to do that with services and not just dedicated devices. So we're using different solutions like AI to be able to play a role, and there's a certain scale to it to sort of front off problems that are coming rather than problems that have already happened. So we call them wellness checks, but we're devising a system now that will check in on our customers in different levels of frequency that, if there's an escalated issue, whether it's immediate or there was a previous issue that we've uncovered, that would escalate to a monitoring center. And so there's different components to this that we're pretty excited about.
Great, thanks, Jeff. Josh, I want to turn to you. A lot of PERS monitoring or PERS players are kind of expanding PERS into remote patient monitoring, and I certainly know you do a range of different kinds of IoT monitoring. What kind of integrations kind of make the most sense to you, and why?
Great, thank you, Brad. At its core, let me back up just a little bit and kind of describe how we see Avantgarde, one of our operating companies is, we're an event response company, and traditionally those events have come through very reactionary alarms that we're responding to, but through the use of APIs and software, we're able to respond to really virtually any kind of event. And so what a monitoring center is today is almost like a triage center. And so and what are we triaging? We're triaging emergencies so that they don't just get sent to 911 centers or doctors or whomever. So we're able to triage any of these kinds of events, and whether it's weight gain type things, and we're measuring congestive heart failure or whatever. If there's an event that needs a response, we can do that kind of action. One of the innovations that we've done recently that we think will be key to helping with this is the use of AI. And I'll illustrate an example here. In a given hour of the day, let's say the 10 a.m. hour, we might have 600 alarms come in through our monitoring center, medical alarms. And the data tells us that 90% of those alarms are false alarms. And so 60 of them, 10% of 600 actually need some form of help. But we have to talk to 540 false alarms or testing alarms. And so we actually just this year have implemented the use of AI technology, conversational AI. It's similar to Siri, it's similar to Alexa. And it's things like, Betty, do you need help? That's a very simple question to ask. And people are becoming more and more used to speaking to these types of conversational assistants. And so we can quickly limit, reduce down, and filter. But that's the first use of the AI, is to identify the emergency or filter the emergency. But then if you extend that and say, well, with AI, what else could we do? We could say, Betty, how are you feeling today? Betty, have you taken your medications today? And so we see AI as being just a huge innovation to help move this industry forward and help with the emergency response, but also help us more with the more proactive monitoring elements.
Yeah, and that's exactly what I was getting at. Thinking of the PERS hardware in the home and the associated platform as not just an emergency response tool, but also a way to aggregate, sensor data from other sensors in the home that are monitoring health and vitals. So yeah, it's building on that emergency value proposition to something that is, more comprehensive. So yeah, it sounds like you're thinking very much in that direction. I'll toss this out, to everyone else. What might these service offerings look like in the future? If you think five years down the road, what a typical emergency response offering, how it might be expanded, or how might it look differently? Anybody can jump in here. It's a toss-up.
Well, I can say a couple things. I think you've seen this migration over the last 5 to 10 years of devices going from home to mobile. And as you improve connectivity, the landlines go away, the home units go away, when the mobile devices can be as small as the pendant around the neck and be worn on different locations around the body, whether it's the neck, the wrist, a clip somewhere. It's going to increase adoption. Battery life is a very important feature, and that's always the tricky part when you're balancing these devices. How do I increase the battery life and give them something they can wear at least a week? A month would be great. Several months would be even better, and I think we're getting there. But also add additional feature sets that they need and want, and an aesthetic that doesn't make them feel like they're wearing a medical alert. That's really the trick. So that's probably a simpler version than what you were thinking, but I think we're still seeing this transition from home to mobile. And it's now the majority of our business. And of course, with Bluetooth in every mobile device, we'll be able to connect to a number of different peripherals, from telehealth to sensors, and everything in between.
Yeah, it's interesting when we look at our thing, Jeff, we look at our poll data about technological advances, and certainly the thing that people think will have the biggest impact is integrations with health monitoring devices. So 44% of our audience thinks that that's going to have the most impact. AI, machine learning, obviously second. Tad, did you have some thoughts just about what the future of these services might look like?
Yeah, I was going to piggyback on where, I think the PERS devices are going to be even further integrated into the health systems and the physicians that people use. One of the things that we've seen since COVID has hit is a far greater willingness for health systems to work with medical device manufacturers, and oftentimes have asked us to help them understand how to optimize use of that technology. We're at this point in time now where many hospitals have gone through these waves where their ICUs have been full. They've tried to find ways to move as many patients out of the hospital as they can to free up some space, and then look for technologies to keep patients from actually face-to-face contact with a lot of the healthcare workers that they're deploying. So technology that is in the form of a PERS device allows them to do that, and I think healthcare historically has always been slow to adopt technology. There are events like COVID that force their hand, and I don't think that's going to change. I did an interview a couple months ago, and they said that don't you think that healthcare providers want to kind of put the genie back in the bottle, And I said in some cases I think they will want to, but I don't know that they'll have a choice because consumers have far greater choice than they've ever had before as to how to get their healthcare deployed. Consumers, patients want to stay at home as much as they can, and the degree to which they can interact with their physician, they're certainly going to choose to do so. So I think that's exciting because it's a better use of technology than we've had in the past.
Great, thanks, Tad. Shay, I think you want to jump in here as well.
Yeah, it's sort of a piggyback, but as mentioned or as shown in our initial slide, we are fortunate to be collaborating with AARP Innovation Labs. And some of the data that we've sort of sought was, what is the uptake of this technology? And obviously, Parks Associates has provided a fair amount of this data. The presentation just before by Dr. Quintana showed Pew data that was up to about 2015, showing adoption in the older stages of life being at like 10%. In the most recent tech data from AARP, they're showing that people 70 and older, about 62% of them own a smart phone. And interestingly, the wearables, anywhere from 10 to 16% in the 50 and up group own a wearable as of 2020. And that's with an N of 2,500 participants. So it's quite clear that along the lines of what Jeff said, is that the hub, which is traditionally the landlines and the RF station, is going to be replaced by mobile technology. And I think the smartphone will play a major role in that. And then all your peripherals and your integrative products like Bluetooth-based purse, et cetera, will have the ability to hook in to that hub. And as far as the industry as a whole, the future, I think there's going to be a lot more in terms of integrations, partnerships, and acquisitions. We've seen actually quite a few big names where their business is either for sale or there's been some big acquisitions in the purse industry. There's been a fair amount of partnerships that have been announced and integrations. And again, as a physician, I want to see these people cared for as soon as possible. I want these to get help to these people. I want actually the communication with their families to be seamless at the time of emergency. That's what, as a physician approaching this, I've tried to integrate into our product. Using voice-first technologies, real-time notifications, et cetera. I think that's where the industry is going to go, and that's honestly what we're seeing.
Well, sure. And Shay, to your point, according to Parks Associates' most recent research, 73% of those 65 years or older have a smartphone, and 52% have a tablet, and 19% have a smart speaker. So yeah, the form factor situation is changing rapidly, and a couple of years makes a really big difference in some of these things. And so, all the talk of mobile, of course, leads us to maybe talk about 5G just for a second. And so, Tad, I want to come back to you since you're with AT&T. Obviously, reliable, low latency connectivity is critical to PERS. What role do you see 5G having in the PERS market, and what new capabilities might it usher in?
Yeah, Brad, we're obviously extremely excited about 5G, and we think that the possibilities are endless. The combination of 5G and the FirstNet network that I talked about previously, I think allows us to do some things for first responders that are, unique and had been impossible previously. So, we're looking at a number of different use cases to your question. One that we're looking at is, how do we help, those first responders that are going out in emergency situations, those are in ambulances transporting patients back. There's been use of video technology before, but to be able to use 5G technology to get, real-time, clear images back to those that are in the emergency room of a patient that's being transported on an ambulance offers a wealth of possibilities for those that are waiting for the patient to arrive, and to have, very discrete and clear information about what's ailing that patient, to be able to, offer advice to the paramedics in the ambulance as they're being transported, and to be fully prepared for exactly what's needed the minute that they arrive at the hospital. So we see a number of different use cases like that evolving. And what we're trying to do is, insert the technology with many of our customers right now so that they can play with it. As an example, Rush University in my fair city of Chicago has been trialing the technology and trialing different use cases. The thought process is that, we kind of offer a sandbox to them and allow them to tell us what's working best for them and where do they see it deployed. So we see that happening over the course of the year and having a multitude of cases to roll out, in 6 to 9 months.
Great. So we have one question from our audience, and while I ask this, I want to encourage the rest of you, if you have another question, you've got a couple more minutes to get it in for our panelists. So the question is, PERS Solutions can benefit the disability community living independently as well. Can you talk about how you integrate people with disabilities into your research design and outreach? And so I'm just going to toss that out to anyone who'd like to pick up on it. But can you talk a little bit about unique adaptations for the disabled community?
I'll take a stab at that, Brad. For so many years, the PERS design has required the press of a button, and maybe for some, if they're quadriplegic or don't have good dexterity, that could be problematic. And so, one of the things that we're researching and looking into is just, it's the voice commands and having the voice commands on the device level. Just like, hey Siri, it can instead be, help. I said, hey Siri, and she woke up. Anyway, we can say, help, I need help, and help can get there. Now, that accommodates some disabilities, but maybe not all of them. Some people can't speak, or they're hard of hearing or deaf, and so that could be yet another challenge. But certainly, that is what the technology is going to allow us to do more and more things for a wider audience, making the tent a little bigger, if you will. So,
great, thanks. And Shay, I think you have some thoughts on the disability community.
Sure. One thing early on when we were designing on like watchOS 1 or 2, there were things that fortunately the clinical world really helped us in terms of our collaboration with our engineers. And things like color impairment, or color vision impairment. 8% of the population, a subpopulation in the United States, have issues with red-green color blindness. And our buttons were red-green colorblind on Elder Check Now, so or red and green in terms of their colors. So we were able to research the different types of color vision impairments, and we had a setting that actually was adjusted for that. And again, it took an extra 2-3 weeks of development, but it was imperative to get that accessibility option into our app. And sort of moving forward, I've had requests from customers, and I know that I have customers right now on the caregiver side who have hearing impairments, vision impairments on the elder side, cataract use, etc. And we've actually tried to incorporate and use ideas and brainstorm these ideas. And now we have included things like Siri shortcuts, which is a framework that in any language, in any in any phrase that you want, you can actually contact either the monitoring system or your caregivers only. And that's been deployed for a good, few months now. And so voice first technology, really sort of designing for the human element, for the population that you're thinking of. So the human engineering component, and simplifying, even, rethinking the sign up process, where you can minimize clicks in between, what it takes to sign up and to pair with your care group, etc. You don't need to fax things. You just, design or, press a button. Who's your primary caregiver? So you will continue. I think it's an endless journey. And as I think that by listening to our customers and listening to our users, we'll have the opportunity to, I think, really innovate with accessibility options on our different platforms.
Great. Ted, I want to come back to you. You spoke earlier about 5G and implications for first responders, but more specifically, can you speak to the future of FirstNet with PERS Solutions?
Yeah, absolutely. I mean, this network has been, adopted with true fervor from the first responders that we work with. To be able to move from radio technology to cellular technology has been huge for them. And it has launched us into a whole number of devices that they can get access to, and applications that we can roll out to give them visibility into the well-being of those they're caring for. So the combination of FirstNet and 5G is going to allow us to do all sorts of different things, because there is such greater reliability, there is such greater speed, and obviously, as I was mentioning before, for anybody in the first responder community to have greater insight, to get those first insights immediately, the level of care that they're able to provide is better. The level of safety they have in every situation they go into improves. So we feel like we're just scratching the surface on how to combine those two and give all the benefits of a separate network and prioritize mobility that the first responders have with the speed and reliability that comes with 5G. And so again, we're kind of sandboxing that out, but we see a number of applications coming forward in the next year or so.
Great. Well, thank you, Ted. Thanks, Josh, Jay, Jeff. It's been a great conversation. Wish we could stay longer, but we're going to have to wrap it up. So we wish you well. Thanks for joining us today.
Thank you.
Great.
Thank you.
Next up, we have our final panel of the day, new innovations in tech impacting consumers and healthcare. So stick around while we get the video feed set up, and we'll be back with you in just a moment. All right, good afternoon. Welcome back for our panel this afternoon on new innovations and tech impacting healthcare. Certainly throughout this conference this week, we have talked about how necessities of economics and access are driving this rapid change in healthcare innovations. At the outset of this track today, I talked about the level of venture capital investment, and there's a wide range of technologies that are being invested in. Certainly, we've seen just the uptake of digital therapeutics, telemedicine, remote patient monitoring see substantial gains in this last year. So in this panel, we will explore a variety of market forces that are driving this range of new technologies. We'll talk a little bit about some more far-reaching technologies and their future impact on the market. I'm pleased to have Andrew Althofer and Nathan Traynor join me this afternoon, and so I'm going to give them each a couple of minutes to introduce themselves, their companies, and their perspective on the market. So, Andrew, good afternoon. Welcome. Thanks for joining us.
Thanks for having me. Appreciate your time.
Yeah. Well, tell us about CirrusMD and yourself.
Sure. So I am one of the co-founders and the CEO of CirrusMD. And when we started, we really built ourselves off the vision of my co-founder, Blake, who's an ER doctor. And he wanted to create the same experience that his friends and family have whenever they had a medical concern for everyone. And it is, how do I get access to care efficiently with the ease of just sending a text message? And that's really where we started. and have really built from there. COVID has provided a really interesting opportunity for us to prove out the scalability of that approach. Our doctors are able to deliver more care per hour than the more synchronous forms of telemedicine focused on phone or video. We were able to manage through a 400% increase in patient volume with a sub 1 minute response time. And that really has been something we've long focused on, and has also provided us an opportunity to open a lot of other channels. We tend to work with large payers, integrated delivery networks, and oftentimes it's not just can we connect you to a doctor, it's how do we successfully navigate you through the system, connect you to additional clinical and non-clinical resources, whether that be pharmacy, care management, behavioral health, all from a single access point that is, like I said, as easy to engage in as sending a text message.
Outstanding. Thanks, Andrew, and welcome back. Next up, welcome Nathan Traylor. Nathan is president and co-founder of Orbita. Good afternoon, Nathan.
Hey, Brad. How are you doing? Can you hear me all right?
Yeah, you sound crystal clear.
Good. The power of the earbud, or the Microsoft or Apple technology. Yeah, so my name is Nathan Traylor, president and co-founder of Orbita. And Orbita started about 5 years ago as a technology-first company in healthcare. And where we've really cut our teeth and what we have prioritized is helping our clients tap into the power and potential of voice and conversational AI technology across a variety of use cases in healthcare. So we serve major health systems, we serve pharmaceutical firms, some payers as well, and a few medical technology and telemedicine companies, all of who share the common vision of the power of voice and conversational AI to transform how patients engage with their own care plans and how they interact with their care providers. So essential to what we do is through a SaaS platform that serves as a layer. Consider it the picks and shovels technology that's required to develop, build, optimize, deploy, and maintain these voice and conversational AI solutions. If you see on the diagram, we present ourselves as omni-channel, which means that we're not parochial about the device that the end user is using. What we care about is reaching them where they are through the devices that they use every day. And that may be a smartphone, it might be one of the relatively new smart speakers. It could be over a conventional telephone line. And the ideal is that you are able to reach them regardless of the device that they're using.
Great. So thanks, Nathan. Appreciate that introduction. Both of you are companies are really at the forefront of applying AI to these kinds of digital therapeutics. And as I shared at the outset, consumer awareness certainly is growing about the availability of these tools and the utilization of these tools and the willingness to use them again. Andrew, you referenced COVID-19. You know, I'd love to begin again with just kind of both of your experiences with the impact of the COVID-19 pandemic on utilization of these kinds of tools, and what do you think will be kind of lasting effects of this particular chapter of our history? Andrew, I'll let you start off.
I think I'm muted.
No, we hear you.
You can hear me now? Okay. Yeah, so I think the broad market awareness of all virtual access points has become critical. People realized as we saw 70–80% of the brick and mortar shut down as part of COVID that we need greater access to care. And solutions like both of ours can help provide that. Patients don't know where to go. My primary care doctor's office is closed. What do I do now? What options are available to me? And I think that the heightened awareness, and you know, we tend to focus on the payer space and large employers, they have all realized that a lot of the existing solutions that they had either did not work out as expected as part of COVID, or that they need greater access to be able to service their employees, their members, whoever that might be that they're at risk for, in a very efficient and scalable manner. And that is a really cool thing that I think will serve a longer term opportunity to rethink how care is delivered. I mean, a lot of the payers are talking about virtual first care plans, changing what primary care means. Do you have a relationship with an individual or a relationship with the service? And I think there is a lot of exploring going on right now, at least in the customers that we work with, around how do we actually rethink the entire care delivery model and potentially flip it upside down based on where it has historically been. And to us, that's really exciting. Like I said, we saw an overnight explosion in utilization. We've always prided ourselves on having really good utilization as measured by total encounters divided by population with access in a defined population. Our commercial utilization pre-COVID was about 20%. In COVID, it accelerated to around 80%, which has just been crazy across the board. And we've even had Medicaid populations that are seeing between 10 and 20% utilization, which is just absolutely unheard of. And so it really has raised awareness. Consumer expectations have been changed. And I think we as an industry, speaking in telemedicine and more broadly within healthcare, also need to rethink the access pathways, because we've now lived through an event where the traditional access pathways in many cases were closed.
Great, thanks for that. Nathan, what's been your experience during COVID and learnings from the experience?
Well, I think our experience was like every other health technology business that serves this industry. In March of this year, which was a very interesting and frankly pivotal month for our company, like a lot of companies, what we saw on the one hand was a lot of clients dramatically shifting their priorities, and really starting in February. So in response, we set about shifting our own priorities to provide our technology, our voice and chatbot technologies and services to support these new priorities. And it started out quite simple, right? How do you deliver educational information around COVID-19? How do you support symptom monitoring scenarios? And that has evolved over the last several months, really 5 months or so, to include richer multi-channel engagement solutions, all AI-powered bot and voice solutions. But in short, what it's done for us is, one, we've been as busy or busier than we've ever been in terms of supporting the use cases that are coming to us. It's also required us to take a major leap in innovation, because nothing puts a focus on innovation than a very, very short timeline and demanding project schedules for our clients. The lasting change that I would say we could see, and I'll just echo what Andrew said, is that it's clear that remote care, telehealth, and other virtual care technologies are taking center stage. Anything that can reach a patient where they are, this patient-centered care, to improve visibility into their health, to address health and safety and infection control concerns that exist in this new world. All of these while also improving the efficiencies of care through automation. This is really the lasting change. I don't think this is just a one and done. We're seeing this being a fundamental shift in the industry.
Sure, that makes a lot of sense. So I'm wondering, with the rise in the scale of interactions for both of your services, what have you learned about user experience or about consumer perceptions of these services? With a lot of data, you can learn a lot. So during COVID, have you kind of had some new insights about how consumers are using these services or want to use their services? Are they evolving in their sophistication or their engagement?
I would say yes, absolutely. People have experienced all kinds of new forms of virtual care than they've previously ever really interacted with. I mean, that's always been the big dirty secret of the telemedicine industry is most of the services out there have had very low engagement rates. Now, as people have begun to engage, in some cases, they've had very positive experiences. And in other cases, they've had 6, 8, 10, 15-hour wait times. There has been a lot of service failings. And I think there's been a lot of education for the end consumer of care services around what the right mix of services for them is, what the right modalities for access are. And so I think that education is critical in informing kind of a user-centered design. What does a patient want and need? On our side of things, what we have seen, the more volume we have going over the platform, it provides us an opportunity to expand our scope of services. Because we can, using data, break down. We know we're going to have X number of chronic disease patients with this condition on a daily basis, given a certain set of volume. We are going to have a increasing frequency of behavioral care. And we've expanded aggressively into behavioral because as the stress and anxiety that people are experiencing as part of COVID, most people come onto our platform presenting for physical health. We have a very integrated physical and behavioral model, which works very well. And as people would present with physical care conditions, we began to realize about a third of people coming on our platform also had severe underlying behavioral concerns going on, many of them COVID related, and they didn't even necessarily self-identify with that, but we were able to get them in touch with a psychiatrist or a psychologist, depending on their needs, in an integrated fashion with a family practice doctor or an ER doctor who is addressing the physical side of their concern that they presented with, but we're able to round that out by bringing behavioral in on an as-needed basis. And we have seen a significant increase in patient need due to the shutdowns, due to uncertainty at work, due to all kinds of other social determinants that are being impacted by COVID in a way that we weren't really expecting. But because as our volume really began to increase, it made sense to expand into a much broader multi-specialty care team approach across a variety of specialties. And with more volume, it opens the opportunity to have a greater mix of license available on a staffed basis to serve the patients.
So Andrew, I'm curious, are you running any kind of emotional analytics to detect behavioral health issues?
We are doing sentiment analysis. There is a lot that we're doing on NLP. We take a little bit of a different path in the market than many of the other vendors that are kind of deemed asynchronous. We always connect you to a physician first who will be guiding your care journey. Behind that, we're able to bring in NLP and AI and a variety of other technology solutions to support that care journey. Whether it's automating the COVID questionnaire because a patient presents with COVID, whether it be doing things like sentiment analysis, there's a lot of really interesting things around heuristic mapping that we're able to do because everything's being captured in that text-driven encounter. And so that data set's very rich, and it's providing us an opportunity to build a lot of tools focused predominantly on physician efficiency, but also creating a richer and better understanding of what the patient's needs are going to be, and then creating efficiency in the throughput of that provider's ability to deliver care.
Great. Nathan, back to you. So what's the scale of this experience? What kind of learnings has it offered you?
Yeah, I would put it in two categories. One is just the engagement rate for some of the newer digital solutions that we power. We've certainly seen a significant lift in terms of even within particular scenarios of users, patients gravitating towards these new virtual care assistants or bots. We have a couple of clients who are serving patients in very broad communities, in excess of 1 million patients registered in one application. And the level of engagement is very, very high relative to what we would typically see. And not that we didn't see good engagement before, but what's happened is that we're seeing that engagement as a percentage of overall experience for these patients increase. The second thing is, at a lower level, the nature of the requests and what we can learn from those requests as they come through. We posted a free COVID-19 bot, like a lot of people did, back in March and April. And ours was put up on our website. It's available now at orbita.ai. You can try it out. But we also made it publicly available. So if anybody wanted to try it out, post it on their website, they could. In the course of doing that, we saw quite a bit of data come through in the way people are interacting with that bot, both in terms of the raw data when they're reporting anonymously their symptoms or lack thereof, and then also for the natural language interface, the nature of the questions, how they pose those questions, what were the most common questions that they asked. And that allowed us to optimize our knowledge base, optimize the partnerships that we have, content partnerships for high-value clinical content, not just from the CDC, but from organizations like the Mayo Clinic. And to use that as a way of informing and shaping what we're bringing to our clients in terms of solutions going forward. So it was been quite enlightening, but the volume is what's stunned us most in terms of just adoption and engagement.
Yeah, listening to both of you talk, it's, it's just recognizing this is like wartime. It's like a space shot. It's like, there's so much rapid development that's happening, driven precisely by the need that's out there. I want to turn to our question for our audience today. We ask more broadly, what emerging connected health technology do you think will have the greatest impact on consumer healthcare in the next decade? You guys will be pleased to know virtual health assistants. We're the top one at 32%.
Yeah.
Obviously, connected medical devices, we've talked a lot about that. Ambient sensors in the home at 21%. Not so much bullishness on VR, AR, exoskeletons, personal care robots. I think a lot of us realize that as far as consumer-facing application of some of these, we're still a few years out, although there's some very promising and exciting things happening with those. Kind of centering on virtual health assistants, which is what we've been talking about. What are the other market forces outside of COVID that are really driving the adoption on both the provider and payer side, as well as the consumer side for virtual care assistants? Nathan, I'll let you start this time.
Yeah. Well, it's difficult to point out larger forces that aren't in one way or another associated with the pandemic, right? If you kind of pull them apart. But there's certainly a few things that were happening before COVID-19 that were impacting the development and adoption of health tech, at least as we've seen it. The first one, I think, is just maybe what's been highlighted throughout this virtual conference, and I certainly heard it on the previous panel, is the rise of AI-powered virtual assistants. And one of the reasons why they've received considerable attention is during the pandemic, is really for all the reasons we've discussed, right? How do you reach the patients where they are? How do you provide them an intuitive, accessible user experience? But the fact is that technology has been there and has advanced really quite considerably over the last few years. And what's interesting about that macro force is that, in my assessment, and not just mine, actually, the technology was actually ahead of the use cases in the market. Andrew mentioned sentiment analysis. This technology has been around for a while, but it is getting much, much better, to the point where it's not really just looking for the words that users are saying, patients are saying, I feel lousy, I feel great. It's analyzing what are called voice biomarkers, actually analyzing the tone of voice and be able to recognize and categorize with good probability that they're depressed or they're having difficulty breathing. That technology exists now. And what's emerged is the demand and the use cases for applying it. So it's an interesting macro force that the technology is advancing. It's there. And now we have an opportunity to apply it in some very important use cases. The second one I'd highlight is just in healthcare in particular, some new players, maybe not so new, but new to a lot of folks entering the market. The big technology players like Amazon and others have aspirations, making announcements that seem potentially disruptive and have a potential to inform strategies for healthcare organizations and the industry as a whole. In fact, just last week, the Amazon Alexa team announced their next wave or phase of their HIPAA eligible Alexa Skills Program. So HIPAA, most people will know, is the U.S. regulations for managing privacy and security of healthcare data. And one of the challenges with voice assistive technologies of any kind, and particularly smart speakers, is that it's not easy to make them HIPAA compliant. There are general privacy concerns about them regardless, but there are also regulatory concerns, and one of it is HIPAA. So Amazon made an announcement a little over a year ago for their first wave of their program, which was a limited invitation only one. This next one allows people, any developer of an Alexa skill, to apply to build a HIPAA eligible Alexa skill. And what that means is that you can have a voice assistant that works over one of these Amazon devices like an Echo that can handle protected health information, that can allow them to communicate, you know, their body weight or blood pressure or other needs in a way that ostensibly is compliant with the regulations of HIPAA. So that macro force is, and Amazon's entry into the market, I think, is going to continue to have an impact.
Great, thanks, Nathan. Andrew, what do you see out there as a larger force?
Yeah, well, I totally agree with everything Nathan laid out. I mean, he's spot on some of those driving forces. And, you know, I think for us, being directly in clinical delivery, CMS is certainly getting more proactive in exploring new modalities, new payment models. For example, earlier this year, pre-COVID, they came out and are now allowing reimbursement for text-driven care that takes place within a 7-day window. And so I think you are seeing greater creativity with a nod towards, it's not about a modality. So we focus on text. We can do phone and video, but that's a very small percentage of what we do. Voice is a whole other avenue, and we have voice integrations, and, you know, specifically on the provider side, most of our doctors are using Dragons. And so we also absolutely do some things around voice as well. But I think you're starting to see CMS beginning to acknowledge that it's not just about, can we reimburse at parity for a video encounter that takes place? It's how do we begin to encompass a wider variety of modalities? And that was already in motion pre-COVID. And you see things from the Alliance for Connected Care and the ATA and a variety of other groups that are pushing advocacy to think much more broadly, to make cross-state licensure easy, which is a huge challenge. I mean, we operate a 50-state physician network, and that is a complicated, expensive thing to maintain. The state regulations are consistently changing, and there are favorable tailwinds that really had nothing to do with COVID that were already going down this route because we need to figure out how to make things more efficient and more scalable. COVID only shined a really bright spotlight on that. And I think accelerated by years some of the things that were already in motion, in that, you know, telemedicine has been proven out to deliver value. How do we make it more accessible, easier to scale, more efficient? And so those are a lot of the things that we think about. And then I think also, at least as it pertains specifically to how we think about things, we've really learned from the data set and all of the volume that we've experienced over the past 6+ months has further aided things around, again, back to that emotional intent understanding of what's going on clinically. It's become very easy for us to identify actively suicidal patients, for example. There are certain word patterns that they tend to use. And that sentiment analysis is, I think, really interesting. And it's not just something we're doing. I know that there are a lot of other companies working in this space to understand what does it mean when somebody's saying a certain thing. And we, you know, are, I think, getting very smart as an industry in being able to assess efficiently and really understand where there's real risk. How do we prioritize patients? How do we make sure somebody who is expressing something, whether it be respiratory distress or an actively suicidal patient, how do we make sure that they are getting instant service and are effectively moved to the front of the queue, so to speak. I mean, we always try to manage to sub 60 second for everybody, but we're now able to identify certain things that are very unique, which to me it's a fascinating thing, but also something that I believe delivers a lot of value to the patient.
Well, super. Well, listen, we're about out of time, and we didn't have any questions for our audience this afternoon, but if some more come in, we'll make sure we get those to you. Thanks again to both of you, Andrew and Nathan. It's been great to learn more about your experiences, and certainly exciting to see the rising familiarity and awareness with these tools, and I know you're helping a lot of people. So again, thanks for joining us. Be well and be safe.
Thank you, Brad.
Thank you.
All right. Well, this has been Brad Russell on behalf of the whole team at Parks Associates, on our sponsors and our speakers. We want to thank all of you for joining us and keeping this vital conversation going. If anything, COVID-19 has impressed upon all of us the urgency of our work in leveraging tech-enabled care to improve the well-being of those we love and care for. Now that our virtual experience, actually, it's precedented now, it's not unprecedented. We hope you'll continue to take full advantage of our virtual experiences. Next up, we are hosting a one-day event on September 16th entitled Connected Health at Home, the Next Smart Home Market. Every one of you who has joined us for Connected Health Summit can use this free promo code, COMMUNITY, you see on the left side of the screen there. To register for that event, you'll also receive an email reminding you of this complimentary code, but we'd love to have you join us in just a couple of weeks. And then finally, we will be hosting our annual flagship event, Connections, completely virtually online on Tuesday, November 10th through Thursday, November 12th. Again, we have a great lineup of speakers and 3 full days of topics across all the verticals that Parks Associates research addresses. So again, thank all of you for joining us. Be safe, be well, and keep doing some good.